He was a retired lieutenant colonel. He did not have any family. I had a volunteer go in and that particular volunteer traveled a lot. So he would just go in there and tell him stories about his traveling and what he was doing. And the patient was always in the fetal position and he always had a sheet over his head. And within just a few weeks, like the sheet came down from his face and he never opened his eyes for the volunteer, but just the small interaction was amazing.
For those that maybe don't have a lot of friends or family that visits, just having somebody they can talk to. A lot of times I don't even refer to them as volunteers. It's almost like they just have a friend visiting.
And they do make a huge difference. Simple presence is a true thing. And so it's just an awesome thing for our patients.
Some caregivers, they don't have a lot of support from family members or friends, and so that they don't really have time to, go out and run errands or, do things that they need to do to take care of their own health. So caregiver burnout is, when you're so focused on taking care of the patient's needs that they neglect their own. And, us having the volunteers go in, it helps prevent that, which also helps the patient because, if you have a fresh caregiver, then they get provided better care too. So we have volunteers that assist with making bears for patients. And what we do is take a couple of items of clothing that were the patients that the family gives us, and a volunteer turns that into a bear that's a keepsake for the family. We started doing the pen pal services, and that's good for volunteers who may be a little uncomfortable visiting a patient but still want to help provide support. The need is all over the board. We need all kinds of volunteers. One thing I try to do is place people's hobbies or their talents with a position that they could use to help hospice patients. So you might not know what exactly you can do, but just reaching out to somebody, we can help find the right position for you.
But just to see what our volunteers do for our patients and their families is truly a blessing. Because we have some patients that don't really have any family at all. And so to put a volunteer in with a patient is very rewarding, heart rewarding.